Hello everybody, we are again back with the same topic, that is the snake bite management. We had already done the first part. Now we are in the second part of this snake bite management. This is the last part, and we'll see how the snake bite cases are being managed in hospital setup. We'll start with a term which is known as the ophitoxemia. This is an age-old term which generally means what is the different type of clinical features that is present in different snake bites. Now we look at the different types of snake bite. There are usually 4 types of bite. The first one, we call it a business bite, that is meant for business. Usually they are seen after hibernation. Business means here the snake actually tries to kill the organism or the substance that the snake bite. Now this kind of bite, usually as it is usually seen after hibernation, most of the cases we find that the bite in these cases are usually fatal. Whether it is for the prey, it can be a small animal, or even for higher animals like a human being. The reason is simple, that during the period of hibernation, most of the snake venom, they get stored into the venom sac, and just after hibernation the bite that usually occurs is having high concentration of snake venom. The second one is another common bite which is known as the defense bite. Here the snake gets frightened of most of the higher group of animal, and they try to defend himself or herself from that animal, and in order to do so they give the bite. The third one, we call it a dry bite. As the name suggests, that mostly this kind of bite, they do not cause any kind of envenomation, because the snake do not give any kind of venom into the skin. And these kind of bite are a good amount, and it nearly consists of near about 30 to 40% of the snake bites that usually occurs as far as the human beings are concerned. The last one, but not the least, is the superficial bite. Here the snake venom is not being entered into the body, mostly it is superficial, and the fangs, they do not usually penetrate into the deep into the skin, and naturally the chances of envenomation is nil. So we start with the signs and symptoms of viperine bite. We have divided this signs and symptoms into 2 groups. It can be a local signs and symptoms, or it can be a systemic signs and symptoms. When we look at the local features, we will see that they are usually localized in an area or in an entire limb where the bite has occurred. So what are they? They include the rapid swelling at the bite site. It can be discoloration or the blister formation. In extreme cases, there can be gangrene and necrosis. The reasons, as we know, that it is mostly because of the different effects of the enzymes that is present in the snake venom. In other cases, we have also seen, as far as the viperine bites are concerned, the bleeding from the site along with pain is also seen. The bleeding from the site, as you all know, this is mostly because of the coagulation disorder we have already described when we were discussing about the different type of enzymes that was present in the snake venom. As far as the systemic features are concerned, the whole array of different systemic features, the reason is very simple. It is because of the coagulation disorder. So what we have these generalized bleeding features like that of epistaxis, hemoptysis, hematemesis, bleeding from the gums, hematuria, melena, hemorrhagic area over the skin and mucosa. So these are all the generalized bleeding features that is seen when there is viperine bite. So again, please remember V for V, that is all the vipers, they causes vascular disorders, and vasculotoxic are the different enzymes that is present in the snake venom of vipers. Now here is the signs and symptoms of the Elapid bite. In the same way, we divide it into the local features and the systemic features. And other local features, we'll see that these are the common features that is seen. In case of Elapid bite, the fang marks are present, but this is true as well as false, because there are a group of Elapid bite, especially the crates, where we do not get any kind of fang mark. So please do not rely on the fang marks, because it has been a misnomer that two pinpoint fang marks are highly suspicious of snake bite, especially toxic snake bite. But these are not the features, because most of the non-venomous snakes are also have these kind of fangs that we have already described, and they do not give any kind of venom. But other local features that is seen in Elapid bite are quite consistent. That includes the burning pain. It can be swelling and discoloration. We'll see that what are the species that causes swelling and discoloration. It can be some amount of serosanguinous discharge can be seen from the side. The local symptoms are milder in comparison to that of viperine bite. Again, for your knowledge, please remember that there are species of crate which is very commonly seen in Midnapur and as well as the Dinajpur districts, as well as in some parts of Bardhaman district, where we have seen that there is absolutely no local feature. And if this thing happens to a common people, they try to neglect that feature. Since there is no local features, they try to neglect whatever pain, small amount of pain that occurs, and that causes the case fatality. What about the systemic features? The common systemic features are the paralysis. So there are two stages. We call it a pre-paralytic stage and a paralytic stage. In the pre-paralytic stage, the common signs and symptoms that we have seen are the vomiting, the headache, the giddiness, and the weakness. These are very non-specific. Again, the people try to take some medicines or try to avoid all these pre-paralytic stage features, and that causes the case fatality. But whenever the paralytic stage starts, which starts very soon in case of crate bite, it includes the ptosis, ophthalmoplegia, it can be convulsion, and bulbar palsy resulting into respiratory failure and eventually death. So there are a whole lot of area where the people die before they can come to the hospital after they have identified that something wrong has happened. Now just look at these pictures. This is a picture where we have shown you that these are the fangs mark. These are the fang marks, and please remember that this is not a absolute necessary sign that must be present in a snake bite. There are a whole lot of snakes, poisonous snakes, which bite and we do not get any kind of fang mark. This is another good example of a local swelling and redness. Here also you can see that this is the fang mark. Here it is. These are the two things, that is the fang marks and this redness, as we have already told, and the swelling, as you can see here. Now the swelling can be much bigger than that here, as you can see, but this also has another feature which is said to be the local blister formation. So these are the blisters. This one is a blood filled blister, okay, and these blisters are very common in viperine bite. And this is another important feature. If we just dissect out a person who has been bitten up by a viperine snake, here we will find that there is extravasation of the blood in the entire limb because of, as we have already told, because of the coagulation disorder. Now the last feature that we had described is a local gangrene and necrosis in viperine bite. This picture actually shows this one. You can take this glimpse in your mind how it looks like. These are the pictures of some of the neurological snake bites. The first picture on your left hand side shows ptosis. The second one shows the ophthalmoplegia. Here you can see that due to this one, you can see here that the eyeball has been deviated on the right hand side while this eyeball is at the middle. This is because that this lateral rectus, which is present in this right eye, is being acting unopposed. Naturally, this muscle, that muscle that would have taken this eyeball to the middle, is paralyzed, and hence due to the unopposed action of this lateral rectus muscle, the eye is now being deviated laterally. Now we have a summary of manifestations of different snakes. If you just look at this entire picture or this chart, there won't be any ambiguity except a few areas. I will try to highlight those areas, and as a physician you should remember that these are the areas that has to be kept in mind. Okay, let us start with the first one. The first one is under the column of cobras. You just see here that the local pain and the tissue damage, yes, the cobra, as far as the cobra is concerned, it is written yes. As we have already told that these are mostly the features of the viperine bite, but in case of cobra, you can get features of tissue damage like that of the blister formation, the swelling, etc. And now, there is another area. So, this is the area. Here under the Russell's viper, we have written there are some neurological manifestations. We will discuss it later on. Please remember that it can happen. Okay? Now, another one. Under the crate, the hemostatic abnormalities must be no, because these are not the vasculotoxic snakes, the cobra and the crate. These are the common features of the vipers, but here you see that in some of the cases, some of the species of crate, you might get some of the hemostatic abnormalities. Okay. Now, let us come to another important thing. This is the response to neostigmin. We have not got into this area right now, but you must remember that mostly neostigmin usually is given in neurotoxic snake bite. So these are mostly for the cobra and the crate. But here you see that under crate, even if we are giving neostigmin, there are some of the areas where they do not work effectively as the cobra. So these are the areas that you must be remembering while you are treating a patient of vasculotoxic as well as neurotoxic snake bite. Now there is a question mark. This question mark is to ask you a question. Can you try to find out any incidents where, in spite of the person being bitten by a viper, is showing some amount of neurological features? I will wait for 10 seconds to let you think on this matter. So the time up. The answer, I think some of you can guess, is nothing but if the bleeding manifestation, that is the major manifestation that is seen in case of viperine bite, occurs in the brain. So if the person is having some amount of subdural hemorrhage or intracerebral hemorrhage, intraventricular hemorrhage, because of the hemorrhagic manifestation, that patient may come to you with whole lot of features that is suggestive of neurological manifestation and not a hematological manifestation. So you must have a keen eye, keen clinical acumen to find out why this patient, though being bitten by a viper, is having these neurological features. Now we begin with the first aid of snakebite management. This first aid has been deliberately added in this section because in most of the cases we have seen that if this first aid can be done by the patient or even by some of the healthcare providers, the life of the patient can be saved. And we have seen in one of the investigations, or rather one of the trials, that the first aid has decreased the death rate to near about 20 to 25%. Now this first aid has been named as this one we call Do It Right. It contains the R, I, GH and T. There are 4 segments. Let us try to find out what are these segments. So the management begins with the first aid, and we will try to see what is the full form of that Do It Right. R, I, GH and T. R for reassure the patient, because we have seen in whole lot of cases where the patient becomes so much apprehensive that there are situations where the patient may even die because of the fear that they has been bitten by a snake. And most of the people think that these bites are toxic bites or the venomous bites, and they will die, and because of that fear the patient deteriorates. The second one is said to be the I for immobilization of the affected part. We call it a immobilization of the leg or the hand. The method of immobilization, we'll just see it in the next picture. Then GH means get to the hospital immediately. So we have actually tried to teach the people that as soon as the people are getting bitten by a snake, whether it is venomous or non-venomous, they are not the person to judge that. It is always better that they get help and they try to go to the hospital as early as possible after immobilizing the area where the snake has bitten. T stands for tell the symptoms to the doctor. That means during the time when they are getting into the hospital, if some symptoms occur, say for example a ptosis occurs, or they are unable to deglute, there is a problem in breathing, they should tell the doctor that during the time when I am coming to the hospital I have developed this kind of symptom. This will help the doctor to differentiate it between a viperine or a neurotoxic bite, and in that way they can start the treatment. Now, what are the things that they should not be doing? The things that they should not be doing is they should not give an incision over it. In most of the films, especially the Hindi films, we have seen that the heroine, when she has been bitten up by a snake, or the hero being bitten up by a snake, the counterpart comes and give an incision and try to suck the venom from the area. So that is another thing that should not be done. But these are the things that is a age-old practice in a whole lot of villages, and these are the problems that the people come up with, that they do all these things and the problem gets worsened. The reason that there should not be any kind of incision and suction, by this time I think you people have understood, because in most of the viperine bite these are vasculotoxic, and this will cause more and more and more bleeding. Again, there are some people who are giving some application of ice or a tourniquet or a chemical agent. So you can see here very clearly that we have stopped asking the people to tie a tourniquet also. In most of the cases, what we have seen is that tourniquet application causes two main problems. The first one is that the tourniquet is so hard or so tightly bound that they not only occludes the venous flow, they also occludes the arterial flow, and as a result it happens that the entire limb gets gangrenous. There is another complication of application of tourniquet is that whenever the tourniquet is being tied very hard and just after it has been released, the gush of venom that is present in the beaten up limb, they come into the systemic circulation and immediately the patient may get some problem. In most of the cases there may be immediate collapse of the patient that we have seen in most of the cases. Now this is the picture that I was talking about the fast aid, and we can see that how the limb is being stabilized or rather immobilized. It is in the same way we do when we suspect that the limb is being broken. In a broken limb, as we have always seen, that we try to give a long we'll say hard substance along the side and try to tie the two ends in the same way. Here you can see it very clearly that a long stick is being applied and the two ends are being tied in the manner. Here we can see that there are the bandage application is also being given. Even if you do not give this kind of bandage application, you can just immobilize it by tying the two ends of this limb using a long stick like structure. You can use anything that is present and is handy to the person who is being bitten up by the snake. Now these are the few pictures where we will see that the things that we have tried to avoid and we have asked to avoid people. The first one is a tight tourniquet. We should not be applying it. The reason we have already described, because of the chances of gangrene. This is the second thing that we should not be doing, is the suction of the area. Here we can see that this is just like that of a syringe. The piston is being pulled up in form to create a suction pressure over it. So these are the things we should avoid, because in most of the cases we have seen that the process of pressing these kind of substances increases the spread of the venom underneath. This is another thing. We have seen that incision is being given and we should not be doing it. We have already described why. And the last one, we should not be doing, or we should not be applying the ice over the area also. Now, what are the assessments that we'll be doing on arrival of the patient? The simple things, that is the A, B and C. So we have already described all these things when we were doing the general toxicology, that is the airway, breathing and circulation. So we are not going into the detailed discussion in this place. The next thing is to give a tetanus toxoid, because in most of the cases we have seen that the bite of these kind of venomous animals, there is a potential threat of developing tetanus. Next, we will try to diagnose the case at ER. What we mean by this diagnosis is that whether the person has been bitten up by a viperine bite or that of a neurotoxic bite, we can try to find out the clinical features and try to establish which type of snake has bitten up this person. The next one is the pain management. In most of the cases, especially in case of the viperine bite, we have seen that there is excruciating pain and we will have to manage it by not giving the non-steroidal anti-inflammatory drugs in order to manage the pain, but to give only paracetamol. So in case of pain management, it is the paracetamol is the drug of choice for most of the cases where there is pain. Now there is another important point that has been written here: observation for at least 24 hours. Why it is written is that because there are a whole lot of cases where dry bite has taken place. That means the snake bite has occurred. Yes, the snake has bitten up that person, but it can be a dry bite, it can be a poisonous snake, it can be a non-venomous snake. In whatever situations, whether it is a dry bite or a non-venomous snake bite, we'll have to observe the patient for at least 24 hours to see whether any kind of clinical features of toxic snake bite is occurring or not. Now these are the few pictures where we will see that the things that we have tried to avoid and we have asked to avoid people. The first one is a tight tourniquet. We should not be applying it. The reason we have already described, because of the chances of gangrene. This is the second thing that we should not be doing, is the suction of the area. Here we can see that this is just like that of a syringe. The piston is being pulled up in form to create a suction pressure over it. So these are the things we should avoid, because in most of the cases we have seen that the process of press. This is another thing. We have seen that incision is being given and we should not be doing it. We have already described why. There are a whole lot of tests. Apart from that, we can go for hemogram, the creatinine, serum lipase, amylase, the p time, etc., etc. The ABG, the urine examination for hematuria, proteinuria, or that of myoglobinuria. The ECG can be non-specific bradycardia, or AV block can be seen in case of viperine as well, and mostly in case of the neurotoxic bite. We can go for EEG also. There is a disturbance in the temporal leads. Now these are the different type of investigations that we will be doing. The reason is that because there are a whole lot of complications that come up after the vasculotoxic snake bite has occurred, or that too in case of neurological snake bite. Say for example, we are doing the serum creatinine in order to know that whether the kidney has been affected or not. We are doing the serum amylase in order to know that whether the pancreas has been involved, because in some of the few cases we have also seen that the features of pancreatitis after the person is being bitten up by the vasculotoxic snakes. So there are a whole lot of tests, but the basic test we can do it without any kind of special instruments, that is the 20-minute whole blood clotting time. And if you just go through the books, you will try to find out what are the reasons that we are doing all these tests. All these tests has its own merits, but the basic test remains the same till today. Now, the drug of choice, we call it AVS or the ASV, whatever it can be. It is nothing but the snake antiserum venom. So this is the anti-snake venom that we usually use, and there are a whole lot of company that usually market the AVS, and we do use all these, but I will just let you know that what is this actually, what this anti-snake venom is actually. Now this is the thing that I was just wanting you to tell, that how this anti-snake venom is being produced, because some question that may come up to your mind will have the answer if we can just remember how these antivenoms are being created. Here we find that it's a mixture of different venoms are being given, are being injected into the body of a horse or a sheep or a goat, and the antibody that is being produced against that venom are being collected, and this produces the antivenom. It is not that the huge amount of venom is being given so that the animal die. It is in a very low dose so that the antibodies can be developed, and that antibody produces the antivenom that is used for the human beings. Now, why I have given this picture, because it will give you answer to a question that is often being asked, is that why injecting this anti-snake venom are associated with hypersensitivity reaction. We have seen a lot of cases, the moment you just give this anti-snake venom, the hypersensitivity reaction starts and even the patient can die. The reason is simple, because these are all the equine or a goat or a sheep variety antivenom. So because the proteins of these animals are being involved, sometimes these proteins act as a triggering factor for the hypersensitivity reaction. So this is the reason that sometimes we get hypersensitivity reaction, because they are produced from a different species. Now, if we look at the composition, which is also important for your MCQ of the anti-snake venom, we will see that it contains the antivenom of cobra, which is near about 0.6 milligram. Common crate, it is near about 0.45 milligram. The Russell viper, it is again 0.6 milligram, and the saw-scaled viper, it is 0.45 milligram. So you can remember it very easily. The cobra and the Russell viper, it is 0.6 milligram, and for common crate and saw-scaled viper, it is 0.45 milligram. There can be preservative. Mostly we use the preservative in order to preserve this, and they have a very low shelf life. So we will not stock a huge amount of anti-snake venom. We usually try to get the supply, especially during this period, that is in the monsoon, where the snake bite cases are high. Now this is another important topic, that what are the criteria of administration of the anti-snake venom. The reason that we have given this specific slide is that there are a whole lot of area where the doctors are become very much exuberant to administer the anti-snake venom whenever they come across that the patient has been bitten up by a snake, whether it is a venomous snake or a non-venomous snake. They do not care for that, and they just start giving this anti-snake venom. So we have tried to find out some criteria on which it is advisable that you administer the anti-snake venom depending upon those criteria. We have divided the signs and symptoms into two groups. One is said to be the local signs, and the another one is, we call it as a systemic signs. Under the local signs, we will say that if there is a early extension of the local swelling, that if there is a huge amount of swelling at the site of the bite, or there is the blister formation, or there is a tender lymphadenopathy, which indicates the spread of the venom, or the spread of the limb swelling is in at a higher rate. So these are the local signs that we will be looking for. Okay, so what are the local signs? Again, I am repeating: if there is a huge swelling of the bite site. Number two, if there is a tender lymphadenopathy. If we find that the swelling is going on in a very rapid pace, or if we see that there is spontaneous bleeding from the site where the bite has occurred. So these are the signs that we're looking for to administer anti-snake venom. What are the systemic signs? Now, the systemic signs includes the neurological signs and symptoms, especially in case of the neurological snake bite. If there is ptosis, the muscular weakness, respiratory distress, or respiratory arrest, so we will just start giving this anti-snake venom at that very specific moment. Again, another important thing is the presence of bleeding from the gums, the bite site, or the hematuria, the hemoptysis, epistaxis in case of vascular toxic snake bite. We go for the administration of anti-snake venom without even doing some specific amount of test. If the patient is unconscious with or without respiratory address, we will start giving anti-snake venom, definitely with a history of snake bite. Or if there is the snake can be identified. Okay, now if the snake can be identified, the snake has been taken up by the patient, has been brought by the patient, which has been bitten, which has bitten the person, and the patient is showing some signs of envenomation, we then and there try to administer the anti-snake venom. There are other minor criteria of the systemic manifestation, which includes the unexplained bradycardia, pain in the abdomen, continuous vomiting. So these are the other signs which will lead us to identify beaten up by a venomous snake. We just then we anti-snake venom. So if we just sum up these systemic signs, it includes the neurological signs, symptoms, it includes the vascular toxic signs, symptoms of different type of bleedings, and some other cases, in some of the cases, the respiratory arrest, or the what we have already described as unexplained hypotension or bradycardia, or as we have already explained, unexplained vomiting and pain abdomen. So these are the areas where we can go for administration of anti-snake venom without taking further investigative procedures. Right at the beginning, we can go for anti-snake venom administration. Now we come to the anti-snake venom dosage. Before that one, we will just recapitulate that reconstructing our anti-snake venom is by using 10 ml of normal saline or 10 ml of distilled water for each vial. Now, this amount of dissolved anti-snake venom has to be administered in an infusion, and that infusion is normal saline. Here, if we have to use near about 10 vials of anti-snake venom, then we first reconstitute it using 10 ml of normal saline or distilled water each for every vial, and then take the entire 10 into 10 100 ml of anti-snake venom and dissolve it in 400 ml of normal saline and infuse it over 30 minutes. So this is the method by which we give the anti-snake venom, and please remember that anti-snake venom has to be administered IV. There is no use of administering anti-snake venom in IM route. So this is the thing. For vasculotoxic snake bites, we use 10 vials at the initial stage. And for the neurotoxic snake bite, yes, it is the same dose, but some of the school says that it ranges between 8 to 10 vial. Now there is another situation in case of pediatric age group. There is another situation which is not mentioned here in case of pregnant woman. In both the cases, the dosage will be same and the method of administration will be identical, because we try to neutralize the venom. It does not depend upon the age of the person, whether it is a small child or a big man. The amount of venom that we try to neutralize remains the same. So the dosage will be the same in all the cases. Please remember that while administering the first dose of anti-snake venom, the physician must stand at the bedside during the initial period in order to see whether there is any hypersensitivity reaction occurring or not. If the physician is satisfied that no hypersensitivity reaction is not happening, then he can leave the place. Otherwise, we must keep the vial of epinephrine, or we can say it adrenaline, ready to counteract the signs of hypersensitivity reaction that we have already discussed. If the victims arrive late, what will be the fate? Now, here the recommendation is that we will try to find out whether there is any sign of current envenomation. That is, we will go for 20-minute whole blood clotting time. If we find that the blood is not coagulating, then we will go for the same dosage as we give it in a fresh case. Now, apart from the anti-snake venom, especially for the neurotoxic envenomations, we will have to administer another medicine to counteract the neurological manifestations of the neurotoxic snakes, that is the Elapid group, that is the cobra and the krait. Now, here we have to administer neostigmine, but before we go for the administration of the neostigmine, we go for a neostigmine test, which is done with 1.5 to 2 milligram neostigmine IM together with 0.6 milligram of atropine, which is given IV. The pediatric dose is also being written. It is 0.04 milligram per kilogram of the body weight as far as the neostigmine is concerned, and for the atropine it is 0.05 milligram per kilogram. Now, what we observe the patient for 1 hour. So what we observe is that whether there is any improvement of the neurological signs and symptoms. That means whether the ptosis is being corrected, whether the respiratory rate has changed or not. We call it a breath count has increased or not. We also can ask the patient before giving the injection to take a deep breath and count the numbers, and we just remember up to how many numbers the person can count. After giving the test dose, if we find that the number up to which the person can count has increased, say for example in the initial stage the person could count up to 25. Now after giving the test dose, the person can count more than 25, maybe 30, 40 or 50. Then we can say that yes, the test is correct or the test is okay. Now if the victim responds to the neostigmine test, then we continue the neostigmine with 0.05 milligram of it IM half hourly along with 0.6 milligram of atropine IV over 8 hours in a continuous infusion. But if there is no improvement of the symptoms within 1 hour, the neostigmine should be stopped. So this is how we administer neostigmine in a neurotoxic snake bite. Now these are the few pictures where we will see that the things that we have tried to avoid and we have asked to avoid people. The first one is a tight tourniquet. We should not be applying it. The reason we have already described, because of the chances of gangrene. And finally, again, you can call up our Poison Information Center. The number I have already told, 1-800-345-0033. We can help you to deal with all these tricky situations. There is another app. We have already told that the Snakebite and Poison Information app, we are trying to include the management part also. But till now, it is an excellent app for the general people and also for the doctors, where they can find out which snake is poisonous and what are the common manifestations that occurs in case of snake bite and also in some of the cases of poisoning. So that's all for today. Thank you very much.